Today we'll go over how to know which types of back exercises are best for your back pain. An exercise that your neighbors, aunts, friends swears by isn't going to necessarily be the best for you. Of course, nothing beats having a proper diagnosis from a skilled physiotherapist who can then prescribe individualized treatment based on your pain, condition, age, and physical activity level. We'll first go over the types of back pain and then how to choose the best exercises afterwards. Welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips for back pain so that we can all benefit in our own personal journey to better health. First, before we get to the best back exercises, we need to categorize low back pain according to which position triggers your back pain. This type of classification system is called directional based, meaning the direction that you tend to experience pain will give you a good idea of the most effective back exercise program for you. Keep in mind that the following names I've given are obviously not technical terms. Rather, it can help you remember and relate to the specific set of conditions. We'll get into 5 of the most common patterns of back pain: the benders, the archers, the walking archers, the statues, and the stressors. If you tend to get back pain when you're bending, then we'll call you a bender. In general, benders are by far the most common pattern of back pain. This type of condition is often caused by a disc herniation, pinching, or protrusion. The nerves coming from the spine into your legs can also be irritated or pinched as well. This type of pain is especially common between the ages of 30 to 55 years old. Benders tend to share these signs and symptoms. Number 1, pain that happens when the back is bent forwards, like sitting and driving, or even bending forwards to brush your teeth. Number 2, pain when getting into or out of the car or going from sitting to standing. Number 3, pain that happens with lifting. Number 4, pain that happens with twisting while bending, such as loading and unloading the dishwasher, vacuuming, mopping, or raking, and golfing. Number 5, pain while you're trying to put on your socks or shoes. Number 6, sometimes the pain can go into the legs, knees, and feet. The pain can also be accompanied by tingling, numbness, or weakness. Number 7, sometimes coughing or sneezing can trigger pain. Number 8, having trouble straightening up your back after sitting or getting out of bed. Number 9, your back feels better when you walk. And number 10, your back may feel better when you lie on the floor. Now we'll talk about the archers. This group is the second most common pattern of back pain. Archers tend to get pain when they arch their back backwards. Often the cause of this type of back pain are the facet joints in the spine. Sometimes it develops over time as a result of a previous fall, sports injury, or car accident. Archers commonly notice their pain as they get older, in their 50s to 70s. Of course, there are other reasons that can cause this type of pain, but what's actually important is knowing what type of low back pain directional pattern you fall into. Archers tend to share these signs and symptoms. Number 1, pain that happens when arching backwards, like lying on your stomach, or pain with twisting to the side, like when you're talking to someone sitting beside you. Pain when you stand for too long, like when you're cooking. Pain when you don't move for a long time. Pain with impact activities like running or jumping. Your back tends to feel stiff, dull, and or achy. Sometimes it can feel like a pinch or catching. Your pain generally feels like it's in the spine, but sometimes can radiate into the buttocks or down to the legs. You may have a larger curve in your low back, or you may stand with your belly protruding out. Your back feels better once you sit down or bend forwards. Walking archers. This type of back pain is similar to an archer, but occurs more often when you're over 60. It's typically caused by a compression of the nerves when standing or walking to the point where you just can't walk for more than 10 to 15 minutes at a time. Walking archers tend to share these signs and symptoms. Number 1, often there is no back pain until you walk for a set amount of time. Sometimes standing for long periods can also be painful. Number 2, often the pain doesn't really feel like it's in your back, but rather in the buttocks. The pain can feel like burning, weakness, numbness, or tingling down one or both legs. Number 3, the pain and weakness tends to go away with sitting or stretching out the hips. And number 4, the leg pain feels better when leaning on something like a grocery cart while walking, or leaning forwards while walking or walking uphill. Statues. Much like the Tin Men, statues feel worse when they don't move. The way statues differ from archers, though, is that their symptoms gradually start around their mid-30s. True statues are not common. They represent about 5 to 20% of long-term or chronic back pain cases. Their pain is from an immune system disorder where their body attacks the joints of their spine, causing inflammation. Common inflammatory conditions are ankylosing spondylitis, psoriatic arthritis, rheumatoid arthritis, and lupus. Statues tend to share these signs and symptoms. Number 1, pain is worse with long periods of inactivity. Number 2, the pain has come on very gradually over the years and not as a result from any injury. Number 3, the pain has gone on for years. Number 4, often the whole neck and spine feel stiff, and the stiffness can often include both shoulders, hips, and knees. Number 5, stiffness lingers for a long time and is present especially in the morning and at night. Number 6, the back pain and stiffness gets better temporarily with gentle exercises and movement. And number 7, statues tend to respond well to anti-inflammatory medications such as ibuprofen, naproxen, Advil, or Aleve. And finally, the last category are the stressors. Stressors don't necessarily follow a directional trigger. Much like the statues, they've had pain for months to years. Their ages can range from 18 to 65 years old and beyond, and slightly more common in females. This group represents about 8 to 11% of Americans, and they're the most challenging to treat. Why? Because stressors have complex pain that often starts with a physical injury that has led to extensive changes in their pain processing system. Stressors may have tried all sorts of different treatments that don't seem to give any lasting pain relief, or maybe even make the pain worse. Often diagnostic imaging like X-rays and MRIs don't show any definite causes for such intense and prolonged pain. So what tends to trigger pain and stressors? You guessed it, stress and its buddies: anxiety, fear, anger, depression, guilt, shame, and repressed emotions. Stressors tend to share these signs and symptoms. Number 1, pain seems to get worse during or after stressful events or dealing with certain people. Number 2, pain can come and go and not really seem to be connected to a particular activity or time of day. Number 3, the pain can come on after seemingly minor movements and are hard to reproduce. Number 4, pain can seem to have a mind of its own. Number 5, pain can be in the low back, then move to the hips, then to the knees. The pain seems to move around to different body parts or different sides of the body. Number 6, the pain can feel very hard to explain. Sometimes it's sharp and piercing, sometimes it's dull and all over. Often it's constantly in the background. Number 7, often stressors have very poor sleep patterns and are constantly exhausted during the day. Number 8, stressors may have had a challenging childhood, post-traumatic stress, involved in an abusive relationship or are suffering from caregiver burnout. They often have stressful jobs and tend to put everybody else's needs before their own. They feel responsible for everybody's feelings and downplay their own feelings. Stressors are generally people pleasers that have a lot of difficulty asking for and accepting help themselves. Number 9, often opioids or antidepressants are prescribed for the pain, but they don't often take away the pain completely. And number 10, the pain seems to be better when you're on vacation or when you're busy. Now that you've narrowed down what kind of back pain pattern you fall into, let's talk about the best exercises for your condition. One other interesting thing to note is that as your back heals, your directional preference may also change. As an example, it is common that a bender can sometimes become an archer as they get better. Remember, our spine is meant to move in all sorts of different directions. And while doing exercises in one direction will initially feel beneficial, the human body eventually benefits from more balanced movement. Let's start with the most common pain pattern, the benders. Remember, benders feel pain when they bend forwards or sit. The best exercises to start that are press up or cobra position exercises. Try to do 10 repetitions at a time, starting slowly and pushing yourself a little bit further with each repetition. The cobras may feel like uncomfortable pressure initially, but start to feel better after doing them for a couple of days. It's best to do them every few hours. Benders can fall into two extremes when it comes to their occupation, either a sedentary desk job or a very physical lifting and bending job. Office workers sit slouched over for hours, leading to increased disc pressure and weak abs and glutes. So once the pain subsides, add in some hip stretches and back and glute strengthening like planks and squats. Benders should make it a point to get up from sitting every 30 minutes and walk around. A firm and supportive chair is a must. Benders who do a lot of lifting and bending at work also put incredible amounts of pressure through the spine. The most important habit is to always bend your hips and knees to lift and rotate the whole body to twist and lift. A back brace can help when this is not possible. After lifting, do a backwards bend to restore your alignment. Now let's talk about the archers. Remember, archers feel pain when they arch backwards or stand for long periods of time. Archers need to do the opposite exercises as the benders. That is, archers need to do bending types of exercises. Knees to chest, pelvic tilts, and child's pose exercises are key at the beginning. After the pain is a little more controlled, you need to focus on improving the stability of the spine with core exercises and stretching out the hip flexors. Pilates strengthening exercises are good for long-term management. Archers need to pay particular attention to the way they stand. Often they tend to arch their low back when really they need to tuck in their tailbone and squeeze the glutes to offload the pressure on the spine. Walking archers are the archers that tend to feel pain and weakness with walking. Now, here is a time when we should not follow the saying, no pain, no gain. This type of condition also benefits from bending types of exercises like the knees to chest, child's pose, and figure 4 hip stretch. Frequent sitting breaks when walking is advised. A stationary bike is a good way to stay active and work those leg muscles without triggering back pain. The pelvic tilt exercise, where you try to flatten your back, is probably the most important exercise. It should be practiced in sitting, standing, and walking. Hip flexor stretches are also helpful. The statue group of back pain are those that feel pain when they are not moving. They tend to benefit from gentle but frequent stretching in all directions. Slow and easy yoga stretches that also incorporate breathing exercises can be helpful as long as extreme poses are avoided. Regular pool exercises in warm water are an effective long-term pain management strategy. Also, because inflammatory attacks can come and go, it's important to incorporate adequate rest to let the body's immune system to calm down. Stress management is also key here, as stress and anxiety will ramp up inflammation and pain. And finally, we'll get to the stressor group of back pain. As we said before, stressors are a tough bunch to treat. Physical pain is our body's way of saying no. You'll need a good support system and caring and knowledgeable therapists who understand the complexities of chronic pain. Stressors need a combination of self-care strategies, positive self-talk, as well as progressive, functional, and goal-based exercise. What does that mean exactly? It means practicing reframing your thoughts from fear or stress-based to self-calming and encouraging while working slowly towards a functional goal. A good goal is a SMART goal. SMART goals are an acronym for specific, measurable, achievable, relevant, and time-bound. An example would be working towards walking my kids to school for 20 minutes 5 days a week by October 15th. And then taking small steps of walking 5 minutes for 3 days a week and moving up to 10 minutes 3 days a week and then 10 minutes 5 days a week, etc. Check out our videos on chronic pain for more tips. Long-term strategies can involve drastic changes such as changing jobs, moving, cutting ties with toxic people, learning how to set personal boundaries, and learning how to put your needs first. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.